Hello everyone, welcome to a virtual visit to the Cleveland Clinic Therapy Physics Residency. My name is Alex Antelak and I'm the Associate Director for the Residency Program. You'll also hear today from Bingqi Guo, the Director of the Physics Residency Program. Today we would like to give you a brief introduction to our Medical Physics Residency Program. The Radiation Oncology Department at Cleveland Clinic has 14 campuses, a main campus, and 13 regional centers in Ohio and Florida. We have 19 physicians and 14 physicists at main campus, and a total of 28 physicians and 23 physicists at the regional centers. Residency training happens mostly at the main campus in Cleveland.
All the staff physicists and the dosimetrists take part in education of physics resident. This is a picture of some of the physicists. This is Ping. She's our chief physicist, and also she's an expert in treatment planning and commissioning. This is me. I am the residency program director. I mentor resident for a number of things, my favorite one being resident clinical improvement projects. This is Alex. He mentors residents for their regional practice rotation. He's also the associate director of our residency program. Anthony is our expert physicist for stereotactic body radiation therapy. He also mentors residents for orientation rotation, which is the first month in residency. Matt and Peng are our expert physicists for LDR and HDR brachytherapy. Lan and Nai Chang are our expert physicists for imaging. Yangbing is the mentor of the machine QA rotation, and Jae-wook is the mentor for chart checking rotation. Gennady is our expert physicist for gamma knife stereotactic radiosurgery. In addition to physicists, we also have Andy Miller, our radiation safety officer, and Eric Murray, our lead dosimetrist, being mentors of rotations. Eric mentors the treatment planning rotation together with me and Ping. This is the longest rotation in the resident training. Erin Murray is one of our physicians. She joins us in the residency steering committee meeting to give us feedback on the program.
We recruit 2 to 3 physics residents per year, and we accept both master's and PhD candidates. Currently, there are 5 physics residents in our department. Andrew, Heike, and Farhang are our senior physics residents. They joined us in July 2024 and will graduate in June of 2026. Andrew is our chief physics resident and joined us from Toronto Metropolitan University. Heike joined us from Wayne State University, and Farhang joined us from the University of Colorado. Casey and Alexander are our junior physics residents. They started in July 2025 and will graduate in June of 2027. Casey joined us from Duke University, and Alexander joined us from the University of Wisconsin-Madison. 27 people have graduated from our physics residency program so far. They are all working as medical physicists. 19 of them are in academic institutions, and 8 are in clinical positions. 8 of our previous residents work at Cleveland Clinic, either in Ohio or Florida, 3 of them at main campus, and 5 at regional centers. Geographically, it looks like the majority of our graduates are in the eastern part of the country, but there is still quite a wide range of where our graduates end up.
Equipment-wise, the main campus of Cleveland Clinic has 6 variant linear accelerators, 4 true beams, and 2 edges. One of the edge machines will be replaced by ESOS early next year. The new resident will join us to establish our adaptive radiotherapy program. We have a variety of image-guided radiation therapy equipments, including surface-guided radiotherapy, 4D cone beam CT, and gating techniques using internal fiducial markers or external breathing surrogates. We have 2 CT simulators and a MRI simulator. The MRI simulator is located in radiology, but there's designated time slots for radiation oncology patients. We have 2 gamma knife machines, Icon and Esprit. We have a busy brachytherapy program treating high dose rate brachytherapy, low dose rate brachytherapy, intraoperative radiotherapy, intravascular brachytherapy, iPlaque, gamma tile, and Therasphere. And currently, we are working with our nuclear medicine department to develop our dosimetry program for radiopharmaceutical therapy. In our regional centers, where residents will spend 5 months, they have very linear accelerators and also HDR, LDR brachytherapy. For treatment planning system, we are currently still using Pinnacle TPS, but the physics team is actively commissioning Eclipse treatment planning system to replace Pinnacle. By the time the new resident starts, they will be mainly working with Eclipse. We use Mosaic as our record and verify system, except for the Ethos platform, which will use ARIA. We use MIM for our contouring and image fusion purposes. Currently, we have 2 AI contouring tools to contour normal structures, protege of MIM and another deep learning-based contouring tool called Serapanacea. For Gamma Knife, HDR and LDR, they have their own treatment planning systems.
The 2-year clinical training includes 1 month as introduction and orientation, 1 month as quality assurance, 6 months in external beam treatment planning. 3 months of those 6 will be for 3D treatment planning, and the other 3 will be for IMRT and VMAT treatment planning. 4 months in stereotactic body radiation therapy, 4 months in brachytherapy, 5 months at the Hillcrest Regional Center, 1 month at Gamma Knife, and also 2 flexible months. Residents could use those 2 flexible months to catch up on a previous module, to strengthen a particular area of interest, or even to visit an external institution for a short period of time to learn something that we do not have here. In addition to the major training modules, residents also have day-to-day clinical duties in their 2-year clinical training. They are responsible for in vivo dosimetry, which we use MOSFET and film here, and also IMRT QA for patients. We use EPID-based IMRT QA here. For linear accelerator monthly QA, they share the responsibility with staff physicists. Usually, one machine will have residents for QA 1 month and staff the next month. On average, residents will have 1 linear accelerator or CT simulator for QA every month. For annual QA, in the first year, residents are mainly learning from physicists, but in the second year, the senior residents are expected to lead the annual QA for a linear accelerator. In the second year, residents also learn and then share the responsibility with physicists for chart checks, including initial chart checks and weekly chart checks. Part of the clinical training for residents includes learning to solve problems and making improvements to the clinic. So we strongly encourage residents to participate in clinical improvement projects, and we require completion of at least 1 project during their residency. Some example projects include evaluation of deep learning-based auto-contouring, as well as the dosimetric impact of these structures. Another recent example is a clinical project to evaluate the transition of our VMAT TBI program from the Pinnacle treatment planning system to Eclipse.
There are a number of special procedures offered by our department and institution, which become favorite topics of residents in their clinical rotations and research. We have total body radiation, both the conventional way and the modern multi-isocentric VMAT TBI. We have total skin electron therapy. We have spatially fractionated radiotherapy using the block or using VMAT called the lattice technique. We have cardiac radioablation using SBRT. We like to involve residents in our acceptance and commissioning of new equipment or procedures. With the coming of the new treatment planning system and new Ethos machine, there will be plenty of opportunities for residents to learn and participate in the acceptance and commissioning. Residents also spend a few days with radiation safety department to learn about radiation safety procedures, and spend a few days in the diagnostic physics residency program to learn about the QA of diagnostic imaging equipment such as SPECT and PET. Starting this year, we joined the initiative by our AAPM regional chapter for a multi-institution rotation. So our residents will spend a few days at institutions that are not far, like an hour driving distance from us to learn about equipment that we currently do not have. There are plenty of clinical education opportunities available to physics residents. We have morning conferences, chart runs, and peer review meetings where residents can learn about clinical practice. We have a morning lecture almost every day, given by various physics faculty and physician faculties. Every other week, there's a physics resident and a physics faculty discussion with different topics every time. For example, last time was on commissioning of treatment planning system, and the next one would be on total body irradiation. So in these discussions, a resident will give a presentation and then followed by a roundtable discussion between the assigned faculty and the resident group. We also have bi-weekly research seminars where residents and physicists will take turns either to present about their own research project or a recently published paper. In addition to the educational opportunity within the department, our institution also offers various kinds of educational opportunities. There are leadership development and classes to teach residents how to communicate with patients and families and etc. for those who are interested.
Residents would receive a detailed curriculum on their first day in residency. The curriculum tells them for each training module what are the knowledge and practicum requirements. They will meet with their module mentors regularly to evaluate their progress. They are evaluated by their mentors and by oral examinations. There are a total of 8 oral exams. 6 of them happen at the conclusion of major training modules, including the Introduction and QA modules, 3D treatment planning, IMRT treatment planning, SBRT, brachytherapy, and gamma knife. 2 of them happen at the end of each year. These 2 oral annual exams mimic the ABR Part 3 oral exam format.
Clinical research is strongly encouraged for physics residents. We support physics residents to attend the regional and the national meetings. For the resident who wants dedicated time for research, there's the option of 1 year research time. Currently, 1/3 of our previous physics residents took this opportunity. The timing of the research year is quite flexible. Some took it as first year, some took it the sandwich mode, which is the second year as research year, and there was even one resident who took the third year as research year. The research interest topics of our physics residents varied depend on their skill set, their research interest, and what the resources are and the problems are available in the department for them to solve. So here I list some examples of the papers published by residents based on their research during residency and some of the poster and oral presentations they have given to the APM meetings. You can see the research interest of residents varied widely. There are projects on proton therapy, there are projects on failure mode and effect analysis, and the project on like biological modeling, spatially fractionated radiation therapy, image processing, etc. To summarize, I think a main strength of our physics residency program is the broad scope of our practice. We offer a wide range of clinical services to a large number of patients. We are a team working closely to improve safety and quality. There are some unique features of our program. We have a very hands-on training curriculum which requires residents to work on actual patient cases in all relevant training modules, with the instructions of physicists and dosimetrists, of course. And they have extensive treatment planning practice during residency. We offer gamma knife certificate course to our residents, which is a requirement for any physicist who wish to become authorized medical physicist for gamma knife. There are many clinical education lectures and seminars for residents. We also have fun activities. The upper right figures are our residents with our chairman in the last physics resident graduation dinner. And the lower figures are our residents with the physician residents and the residents from other training programs in our institution. I think they are on a dinner cruise on Lake Erie. Last but not least, we are seeking to continuously improving our residency program from the feedback from our physicists, physicians, dosimetrists, and the residents. Thank you for your attention.